So you just started a new job as a respiratory therapist. How long is your orientation going to be? So honestly, this depends on a few factors. So did you just graduate? Are you a new grad? Or have you been in RT for a while? Before I begin talking about this, I just want to introduce myself. My name is Austin Marks and I've been in RT for about 3 years now. So on my YouTube channel, I mainly talk about respiratory therapy. However, I do have a few other videos mentioning a few other things. If you like what you see, make sure you like and subscribe. It helps me out a lot. I'm also the admin of a Facebook group called the RT Club, and on this Facebook group we talk everything respiratory. So it's full of respiratory therapists, respiratory therapy students, anyone looking to aspire to become a respiratory therapist. So like I said, this is on Facebook and it's the RT Club. So let's just say that you graduated respiratory therapy school, you got your first job. So how long is your orientation going to be? So it's roughly going to be anywhere from 2 weeks to, we'll say, 12 weeks. This honestly depends on how good you are at things, how well you are at handling new information. And they're going to ask you if you're ready. They're going to make sure that you are able to do things on your own. They're not just going to open the gate and let you run. So I actually know therapists who were on orientation too long and they ended up getting fired. So that's a big no-no. So if you are scared, make sure you ask questions and that you actually know what you're doing to be on your own. And I'm just gonna say this now, but you're gonna be scared to be on your own. It's just the nature of the beast. You're not gonna feel very comfortable actually doing things on your own, probably till about six months or so of being a respiratory therapist. I know when I first started, I worked at a place where we had traumas, and I would go to a trauma and I'd be like, there's no way I'm going up there by myself. So I watched a few traumas first, and then I realized, okay, this is what you gotta do, because you gotta think on your feet. You gotta go, because a trauma patient comes in, it could be from a knife wound, gunshot, maybe a terrible car accident, very, very bad things. And patients are not in any kind of good condition, so you have to move, make sure that they're ventilating correctly and protecting their airway. But like I said, I was scared to do that, and it took probably a couple months before I was like, okay, let me in. And now I love traumas. I'm like, all right, put me at the head of the bed. I know what I'm doing. But honestly, when you first go to your hospital, the first week or so is going to be mainly tours. You're going to do easy stuff like NEBs, ISBs, easy PAPs, all that good stuff. They're not going to just throw you in the ICU right away. So what they're probably going to do is make sure you're comfortable with all the floor stuff, and they're going to make sure that you're comfortable with the ICU, and they're going to make sure that you're comfortable with the ER, and then all the other procedures that they may do, they're going to make sure that you're comfortable doing those as well. So like I said, for a new grad, it's going to be anywhere from 2 weeks to about 12 weeks. It honestly all depends on the person and how good they are at learning new skills or feeling like they can do things on their own without somebody holding their hand. Now let's say you've been a therapist for a while now and you are going to a new job, new hospital, new environment. Everything's going to be different. It's going to be scary. So I know when I worked in my PRN place, they gave me, I think, about 2 weeks of orientation because I knew what I was doing. I've already worked with the ventilators there before. The equipment was a little bit different, but I just wanted to make sure that I knew the hospital, and if I was down the ED, I knew where to grab things. And honestly, that was nice because they didn't just throw me in. So if you are going to a new place, it's going to be probably about 2 weeks, maybe a week. I know when I first became a lead, my orientation was only about a week to 2 weeks as well. So going back to you've been a respiratory therapist for a while, you're taking on a new role, either upper management or you're going to a new hospital, orientation is going to be about 2 weeks because you kind of know the scope of everything. Now, I am also a travel respiratory therapist, and my orientation was about 3 days because to be a traveler, you have to have experience, you have to know what you're doing. And at this facility, I already worked with all the equipment before. However, things were different, so I just kind of learned everything, and then they just kind of threw me in. Because, like I said, as a traveler, you gotta be more experienced. You gotta be able to think on your feet. A whole nother video talking about traveling and all that other good stuff. Well, anyway, I hope you enjoyed this video. I hope it kind of answered any questions you may have had. If you still have questions, please leave in the comments below and I'll make sure to answer it. Well, anyway, see you next one.